And I'm recording now.
Okay. I've got 12 o'clock. Does everybody else have 12?
Yeah, I have 12 o'clock.
Okay, so we'll get started, everyone. My name is Kelly Sullivan, and I'm with the BC KT Community of Practice. Welcome to our fourth and final webinar in our 2015-16 season. I'm joined today by Christine Ackerley, who is our communications co-lead for our Community of Practice. Christine will be the WebEx host today and will be managing the technical end of the webinar as well as the Q&A chat at the end of the presentation. Before I introduce the speakers, I would like to remind everyone phoning in today to please mute your lines. The background noise can be very distracting to both our presenters and the listeners. The presentation will be around 40 to 45 minutes, and you will have the opportunity to participate in the Q&A at the end of the presentation by typing your questions into the chat box. Christine, do you want to quickly explain to the participants how to use the chat function?
Yes, thanks, Kelly. So if you go to the top right-hand corner of the WebEx meeting, you'll see a little circle with chat, and if you click on that, you have the option to send a message either to the presenter or to myself or to everybody in the webinar. So if you have a question, you can send it directly to me, and I'll read it out so the people calling in can hear it. You're also welcome to speak and ask your question to the presenter, but using the chat bar might be a better option.
Thank you. So today's webinar is called Island Health's Collaborative Knowledge Translation Activities, Bringing Research into Practice. And I would like to welcome both of our presenters, Wendy Young and Joanne McLaren. Dr. Wendy Young joined Island Health in October 2013 as Research Facilitator KT Coordinator. Wendy completed her PhD in Health Policy, Management, and Evaluation at the University of Toronto and her Master's in Clinical Psychology at Queen's University. In 2013, Wendy relocated from Memorial University, Newfoundland, where she held a Canada Research Chair in Healthy Aging. She was cross-appointed in the School of Nursing and the Division of Community Health and Humanities. She has conducted collaborative health services research and health services evaluations for the past 20 years and has worked with a broad range of healthcare professionals across an array of clinical settings. Also joined today is Joanne McLaren. Joanne is a registered nurse of 26+ years, having worked in various clinician and leadership roles. Currently in her role as Director of Professional Practice for Island Health, she provides leadership and guidance related to nursing and allied health profession-specific standards and scopes of practice, collaborative practice, professional competency development, and using an evidence-based approach in decision-making and practice. So thank you for joining us today, Wendy and Joanne. Please take it away.
Great. Thank you very much, Kelly, for the introduction and for the opportunity to share information. As Kelly mentioned, today's presentation is called Island Health Collaborative Knowledge Translation Activities, Bringing Research into Practice. Joanne and I have structured today's webinar in 4 parts. Part 1, I'll be sharing information about our Island Health vision, the logic model that supports all of our activities, and then briefly highlight the 2 real-world KT strategies that we'll be highlighting in the webinar. In the second part, we had hoped that Tracy Lister would be presenting on nutrition care in Canadian hospitals. Unfortunately, Tracy is not available today, and so I'll address the knowledge translation part of that real-world example. Part 3, Joanne is going to lead the presentation of educating next-gen nurses, building capacity for evidence-informed practice through curriculum-based academic practice partnerships. And then, as Kelly mentioned, we have allowed lots of time for discussion and questions related to collaborative KT strategies. The webinar today, we really have 2 learning outcomes. In the short term, by the end of today's webinar, excuse me, your knowledge of our KT strategies at Island Health will be increased. And in the long term, we hope that this webinar will contribute to further strengthening your engagement in KT activities that lead to an increase in the use of evidence. Starting with standard definition, I think most of the participants in today's webinar will recognize the CIHR definition of knowledge translation. So part one then of our webinar, going through the vision for Island Health, our logic model, and then 2 real-world KT strategies. So Joanne and I are really very fortunate because our vision at Island Health is really very clear. We at Island Health initiated in 2012 a 5-year health research capacity building initiative that was developed in collaboration with the Michael Smith Foundation for Health Research. The vision is, as you can see on the PowerPoint slide, and really the key points in our vision is that we, together with academic organizations, see a self-sustained health research community all across Vancouver Island. So that includes Victoria as well as North and Central Island. And our desired outcomes relate to patients, providers, and the health system. So through research that's collaborative in nature, we hope to achieve those outcomes. This is the logic model that really dictates our activities. And again, this was something that was developed in collaboration with Michael Smith. The outcomes that specifically relate to knowledge translation were clearly articulated some years ago, and the medium-term outcomes include increased dissemination and use of research evidence to inform health system and practice. So in 2012, Island Health, together with Michael Smith, laid out activities that logically would lead to increased use of evidence all across Vancouver Island. As I mentioned, our focus is really on collaboration. Our healthcare providers have many strengths. So healthcare providers are frontline people who see lots of things that could be improved and have the skill set to put forward suggestions for improvements. Our healthcare providers also have access to wonderful data and can help academics navigate through Island Health's healthcare system. Quite a challenge for many academics just in knowing who to reach out to. So our collaboration is with academic organizations across the island, and that includes Victoria University of Victoria, Royal Roads University, Camosun College, Vancouver Island University in Nanaimo, and North Island College. Our focus is clearly on collaboration and not on competition. So our research capacity building initiative really builds on an initiative that Michael Smith started, the Nursing Research Facilitator Program. And here at Island Health, Lynn Cummings was the original nursing research facilitator, and many of our KT strategies really build on Lynn's legacy and her very collaborative focus with the schools of nursing, again, right across Vancouver Island. This figure is a little bit blurred, and intentionally so. This figure is from a 2006 publication from Dr. Lavis, who is really a knowledge translation guru out of McMaster University. So figure A is the model that is traditionally used for linking research to action, and it's referred to as the push model. So historically, academics were the ones that were producing exemplary research findings, and then once that evidence was produced, They would walk across the bridge and share their research findings with the healthcare providers, with the hope and the expectation that the users would be able to use those research findings. So much of the evidence related to the uptake of research findings is based on that push model. And what we know is that there's really a considerable gap in time between when the evidence is produced by an academic organization and when it is used by our healthcare providers. So here at Island Health, we're really promoting what Dr. Levis refers to as the integrated model of knowledge translation, where academics and healthcare providers are coming together on a regular basis, and the use of evidence is planned at the very beginning of research projects, with the hope that if our users are involved in the production of research findings, that they'll be much more likely to use those research findings, and the time between production and use will be shortened. So one of the tools that we're using to promote integrated knowledge translation is produced by SickKids, the Knowledge Translation Planning Template, and I've given you the link there to the planning template. It is in the public domain, and there's no charge to using it. We were very fortunate in collaborating with the Michael Smith Foundation for Health Research in November 2014, and we hosted a 2-day workshop that was entitled The Scientist Knowledge Translation Training. Absolutely wonderful response by our healthcare providers to this 2-day workshop, and the evaluation of their participation in the workshop clearly showed that there was a benefit to attending that workshop. So here again is the link to the Knowledge Translation Planning Template. When academics come together with our healthcare providers to form teams, the first thing that I do is send them this template, and then together we actually work through what are the key stakeholders, who are the key stakeholders, and what are the key messages. From the logic model, we know that we are expecting to increase the dissemination and the use of research evidence to inform health system and practice. And the knowledge translation strategies that we have used with the real-world example related to malnutrition include educational opportunity, journal article, knowledge broker, and opinion leader. And these KT strategies come from the SickKids game on knowledge translation. So they've done a wonderful job of putting together audiences and strategies. And if you haven't seen this game, it's well worthwhile going to their website and finding out more about it. The second real-world example that we'll go through that Joanne has been leading is the one that's involving the School of Nursing. And our expectation is that we will increase student and clinician involvement in the research process, and we are doing that through the KT strategy of practitioner training. So turning then to part 2, the real-world example of nutrition care in Canadian hospitals. As I mentioned, Tracy Lister is the person who's been leading this initiative. She's a clinical dietitian at the Nanaimo Regional General Hospital, and in addition, she's a doctoral student in clinical nutrition. Tracy was invited to participate in a national study, and the methods that were used for this national study were exemplary. And some of the details Tracy has included in this PowerPoint slide. So it was a prospective cohort study, and the goal of the study was to determine the indicators of malnutrition at admission and the effect of malnutrition on length of stay. Data collection was between July 2010 and February 2013. More than 1,000 patients were enrolled in 18 hospitals across Canada, and Tracy was responsible for enrolling 60 patients at the Nanaimo Regional General Hospital. Tracy has provided the link to the website Nutrition Care in Canada. If you click on that link, it'll take you to a wonderful website on the Canadian Malnutrition Task Force, and all of the publications are available free by clicking, again, on the particular publication that you're interested in. So if you're interested in further details, do click there. And the most recent publication that relates to this study is the Malnutrition at Hospital Admission, Contributors and Effect on Length of Stay, a prospective cohort study from the Canadian Malnutrition Task Force. And this was just released in May of 2016. As I mentioned, these were methods that were really exemplary. They used mixed methods and certainly ones that have been well used in previous malnutrition studies. The demographics are as given there. And what was really the key finding that was of interest to our stakeholders here at Island Health was that more than 50% of the individuals that were enrolled in this national study at the Nanaimo Regional General Hospital met the criteria for being malnourished. So these are not individuals who are coming from a very low socioeconomic status. Nanaimo is really central island. It's not a rural and remote location. So these results were really quite noteworthy. In addition to the data that was collected on admission, additional data was collected during the hospital stay. And Tracy has on this slide indicated some of the barriers that were identified to patients' food intake during the hospital stay. So I think it's not a big surprise that many patients report that they do not like the food, and therefore food consumption goes down. Here are some of the outcome measures that Tracy thought were really salient. And for her, what was really important was that approximately 25% of the patients that were enrolled in the study were seen once by an RD, a registered dietitian, during their hospital stay. And 44% of those visits were for individuals that were classified as being well-nourished. Again, Tracy has indicated that these can be very appropriate referrals. It is not their scope of practice includes educating individuals about nutritional status following a diagnosis, for example, of diabetes. So these could very well be appropriate visits to a RD. 37% of the visits were for individuals that were classified as moderately malnourished, and 19% of the visits were for individuals who were classified as severely malnourished. For Tracy, what was really important was, based on these findings, what quality improvement initiative could be introduced within the hospital at the Nanaimo Regional General Hospital. And one of the opportunities for improvement that Tracy indicated was that some of the patients were reporting that they could not actually open the packages on their trays, and so there could be opportunities to have volunteers help with opening those packages. She also reported that some patients were reporting that they were not comfortable eating in bed, and so again, a quality improvement initiative could be developed around alternatives to eating in bed. What I think was really most important in terms of the findings was how complex this issue really is. The malnutrition was diagnosed at admission. So these are individuals who are residing in the community and are coming into hospital and are meeting the criteria for being malnourished. And so the Nanaimo Regional General Hospital can introduce quality improvement initiatives around food intake while in hospital and can start thinking about linking with others to address the malnutrition in the community before people actually get to the hospital. So the goal for our knowledge translation activities, for Tracy, it was really to lay the foundations for quality improvement initiative. So we have a wonderful process here in our research department, and our ethics department contacts the PIs of each study when the ethics file is closed and asks for permission to connect the PI with our research department. So that's just what happened in this case. So Tracy was asked about connecting with me, and she was really delighted to do so. So once I had connected with Tracy, then I connected with our quality people and arranged for Tracy to present at our quality rounds. The response at the quality rounds was really immediate. It was here on Vancouver Island, how could we have that many individuals who are meeting the criteria of being malnourished? And immediately it was, we really need to be doing something about this. So following Tracy's presentation at Quality Rounds, I connected with our Chief Nursing Officer and Professional Practice and Learning, and arranged a meeting with UVic and with Tracy and with others to discuss with our Chief Nursing Officer what could be done. And her response, again, was immediate. You know, we really need to be thinking about doing something about malnutrition in the community prior to coming into hospital. So Dawn asked me to connect first with the Ministry of Health dietitians, and also to connect with the Seniors Advocate, Isabel McKenzie. We did that, and follow-up meetings were arranged, and our Chief Nursing Officer did get together with Isabel McKenzie. We are now planning a November 10th symposium to really address, first of all, what were the findings, what could be done collaboratively with the hospital people and the community and the academics, and think about what intervention could be developed, and then start thinking about what research could be done on whatever is developed in a collaborative way to address malnutrition. And we're really very fortunate. We have at UVic, the Institute on Aging and Lifelong Health, and Vancouver Island University has really been leading the organization of this November 10th initiative in Nanaimo. Vancouver Island University has recently introduced a gerontology certificate program with a focus on healthy aging. The Ministry of Health is very much interested in knowledge translation and we'll be inviting those individuals to contribute to the development of an intervention. There are several initiatives already in place in Nanaimo that are addressing malnutrition. So we will be building on the strengths in Nanaimo to, again, collaborate with those individuals who are leaders in the area. And then because of Tracy's national connections, again, we are very fortunate to have the Executive Director of the Canadian Malnutrition Task Force interested in the use of the research findings, and she has agreed to be a keynote speaker on November the 10th. So with that, I'd like to have Christine pass over the ball to Joanne to talk about the next-gen nurses.
Great. Thank you very much. So hi, I'm Joanne McLaren, and yes, so I would like to carry on the conversation on some of our examples around our capacity building using research and evidence. So this particular project was an initiative that was sparked with collaboration with Island Health partners as well as the University of Victoria School of Nursing. And on this screen you'll see a number of folks identified that were really key in helping to move the initiative forward. But I'd also really like to acknowledge the UVic course faculty that were involved in this work, as well as my team in professional practice, who really sparked some great and interesting topics that we'll talk about later. And then, of course, the students for being willing to, you know, kind of explore a creative idea as part of their academic program studies. So really, in 2014, this really was a conversation between the University of Victoria School of Nursing and both Island Health's Research Department and Professional Practice, where we talked about a collaboration around a unique project designed to really ignite students, nurses' spirit of inquiry. And what we did was we, in Professional Practice, identified 50 real-world kind of practice issues that our team had been working on, and shared those with third-year nursing students enrolled in a nursing research course at the University of Victoria. And then students were then, through their processes, able to synthesize knowledge and generate evidence for practice, which then was returned to Island Health. So in this presentation, we will sort of explore in kind of three parts. Part one being sort of the history and context, just to give you a bit of background around this collaboration. And then part two, we'll share an example of an approach taken by the students to systematically synthesize literature relevant to these practice-based real-world issues. And then three, sort of just what surfaced in terms of insights arising from our collaborative project, and you know, the multiple perspectives that were brought to light around that. So really the goal of this presentation is to share how one unique curriculum-based approach to collaborative knowledge synthesis is growing that culture of evidence-informed practice through multi-level partnerships. So Island Health and the University of Victoria met on several occasions to explore how we could partner around student practice initiatives. And building off of the Health Services Researcher Pathway for Registered Nurses project, in which we were involved, UVic had a want on their end to grow students to embrace that spirit of inquiry and also to make improvements to the program, namely around their research course they offered, to make it more engaging and real life for their students. And, you know, typically we heard that, you know, students don't like research. Students don't like this course and struggle with that. And how can we change that perception of research? Island Health, we, of course, had a want to grow practitioners that see the value in critically appraising and utilizing evidence in their practice, and then taking that and being able to, as Wendy illustrated, translating new knowledge into action. this initiative really supported the vision of the Research Capacity Building Initiative in two important ways, really facilitating that creation of innovative health services and policy research, facilitating the use of research evidence to inform practice, planning, and decision-making. And of course, then always, wonderful is the opportunity to build collaborative links between practice and academia. So this was what we felt was a really innovative way to encourage nursing students to view the use of research and quality improvement techniques as part of their role as registered nurses. Really gone are the days that you can retain all the information in your head forevermore, but rather we know that with technology advances and the rate of new knowledge being exponential, that nurses must have some way to stay abreast of what is changing and also value the importance of doing so. So again, we offered up 50 real-life practice issues and examples that through my office, the professional practice consultants were approached with, either from clinical leaders or staff, real-life things. So an example on the screen there is one topic: can RNs inform patients or clients of lab results? And if so, in what situations? What is best practice? Is there guiding criteria? So we had multiple examples of other types of questions that come forward. Other examples being, what are the implications of bundling breaks on night shift? Or how often should I be documenting? What is the frequency standard around documentation? Specific questions around can, for example, an LPN care for ventilated patients? So under, again, what circumstances, what are the care processes they need to follow? So the list goes on and on. A little bit of context around UVic. This was very much aligned with the University of Victoria's strategic plan, with two key elements highlighted here, really around the want for undergraduate student engagement in research and to building those strong linkages and exchanges between university researchers and those working in the public. Certainly, I think Andrea Bowman's research from October 2011, her findings really are illustrative of the value and benefits to students participating in research or evidence-based sort of activities. So obviously developing research skills and confidence, which we find for clinicians is a real challenge if they haven't got a good grounding in that. Contributing to sustainability of learned skills, supporting evidence-based practice, and then, of course, influencing career decisions. A bit about the University of Victoria's Bachelor of Nursing program. It is a 4-year curriculum. The evidence-based practice is a professional competency identified in the program. And inquiry and research are really threads throughout the courses and program as a whole. And then they do have specific courses in year 3 and 4 that focus around research or data analysis. And again, just reiterating, I think the challenge they were seeing is how to support students to see the importance and value of research for quality care. So I think this really was an opportunity to see if it would hit home for them and make that spirit come alive. So through a journal club assignment, students were engaged in this assignment, which counted for 20% of their grade, and this was done in their 3rd-year nursing research course. And this was a group assignment, and the work was done collaboratively. So the assignment was broken down into 2 parts. In the first part, students developed a PICO question and a search strategy to help them identify evidence and knowledge related to the topic they were assigned. And then in the second part, students synthesized the evidence from one qualitative and one quantitative study they had found to create a critical appraisal of the evidence. Just to help you see the process the students undertook, one of the students that was involved, Angela Wignell, who also completed her field guide practice experience within our department, was involved in this initiative, and she spoke to her experience and offered up this example. The first step students took was really to refine the broad topic they were assigned into a focused question that clearly identified the 4 components of a PICO research question. Angela's particular group took the broad topic of advanced care planning and narrowed that focus to what you see there. What are the barriers which prevent pediatric oncology nurses from initiating advanced care planning conversations with patients and their families? Their next step was identifying search terms, and this really emerged through trial and error. They each searched independently and then shared their articles through what they used a Google document, and then came up with their final list of terms. And then they searched various wide-ranging databases to find articles from which they sourced their information from. The students then were directed to choose, as I mentioned, 1 qualitative and 1 quantitative study, and then they chose those studies that gave them a breadth of understanding on their selected topic. And then they created summaries of each study, focusing on the research question, theoretical framework, methodology, findings, limitations, and implications. They reflected on both their process and findings, and then finally developed a 1-page summary that they then shared with Island Health. I think overall, this initiative was very well received by all participants. The students reported feeling engaged in addressing real-world nursing practice issues. Faculty felt that having recent real examples gave meaning to the lessons and helped students to see the value of evidence and research in their role as practitioners. And of course, Island Health benefited from the students' work and in knowing that students would graduate with a solid foundation for utilizing evidence to address issues and challenges that arise in practice, and of course, for making improvements in their practice. And since the initial pilot, we have repeated it again in a very similar fashion this past January to April term, but only this time Island Health representatives from professional practice were invited to attend the students' last seminar where they reported out their findings and worked to the class. And following those presentations, again, a summary report was provided to our team, which we brought to one of our practice consultant meetings and, asked the consultants that had worked on those initial consultations to review and compare the students' findings with their own to see if there were any additional or new insights or learnings that, that the students could add value to the work that was being done. And being the success it has been, we continue to repeat this wonderful collaborative again in January as well, and hope to grow it. Thank you. And then moving into part 4, I'm going to pass it back to Wendy.
Okay, so at this time, what we would like to do is really open up the floor to discussion and any questions from the participants.
So I see, no, go ahead.
No, it's just Kelly. I thought I would just open it up. Thank you, Wendy and Joanne, for that great presentation. Wendy, I'm just curious, we always hear that it takes about 17 years to get evidence into practice. So what has your experience been in Island Health in terms of research capacity building and that initiative and reducing that time?
Kelly, I think that's a great question for many reasons. So if we start with thinking about the logic model, the logic model includes medium-term outcomes that address the use of research evidence to inform health system and practice. And so I actually think that we need to do some reflections on what does use mean. And for me, it's really not adequate to say we have this particular research study and it should lead to an immediate change in practice. So my own personal experience, excuse me, suggests that many times we don't have a 17-year gap between when evidence is produced and when it's actually used. So in your introduction, you mentioned that I have previous experience with using evidence and decision-making. So I was really very fortunate to be working with, working at the Institute for Clinical Evaluative Sciences in Toronto that was launched by Dr. David Naylor. And David has recently been appointed to chair a review panel on health services. So I think of one really vivid example that comes to mind. So David really believed in integrated knowledge translation, as did the ministry. And this was years ago. So David, on a regular basis, could have conversations as an expert who was really up to speed on the best possible evidence, and he would have those kinds of discussions with the Minister of Health. And so the Minister of Health wanted to know how to allocate funds for bypass operations, for angioplasties, for cath labs. And David took an envelope, wrote out a formula based on his considerable expertise that the minister then took and actually allocated funds in Ontario based on David's back-of-the-envelope assessment. So there's an example where we didn't have a 17-year lag. We had integrated knowledge translation going on where there was immediate uptake by the ministry of the findings. I can think of other examples, too, where if you think about use being a much broader way, or think about use in a broad way. So this was information about the effectiveness of TPA compared to streptokinase. And so decision makers had to decide whether or not TPA should be funded in the complete absence of evidence. And so hospital CEOs decided that they would rather err on the side of saving lives than err on the side of funding only streptokinase. So they made a decision based on what was available. They used it. However, if you decided to take a very narrow view of the use of research evidence, you would have said, there's no evidence at this time to actually fund TPA, so we won't. However, the CEO said, there's no evidence, we are going to fund it. The research made it to the table. It was used. It just didn't happen that the research findings immediately led to a change in practice. So my thought, Kelly, is we really need to be a little bit broader in thinking about what does use mean. And it doesn't mean that research findings are immediately changing practice, because to me that would be inappropriate.
Mm-hmm. Yeah, that's really interesting. And I mean, you mentioned some real champions around wanting to push sort of that knowledge into practice. What do you see as sort of the biggest barrier to that happening? Well,
I think that Dr. Levis, has identified a lot of barriers. And so that model A, the push model, clearly runs into a lot of barriers, right? So people have not asked for the evidence. A researcher has independently come up with the research idea. And so it seems to me that the integrated model that Dr. Levis put forward, in 2006 was really designed to address the barriers. So by having the academics working together with our healthcare providers, I think that reduces the barriers.
Thanks.
Hi there. I'd like to jump in with another question. So you mentioned that Island Health is really trying to promote the use of local findings. And I was just wondering if you could elaborate on how that decision came about, given that we know there's been some challenges in changing practice based on one local study, and how you feel about using evidence from systematic reviews before we change practice.
Well, I think Christine, I think it's a great question. And it seems to me that Tracy's example is really a very good example. So the BC government has a healthy aging framework and has had for quite a long time. They have introduced many policy initiatives around the promotion of healthy eating. And there is really a robust body of literature that stresses the importance of healthy eating. So there are many systematic reviews that relate to malnutrition. So Tracy's study did produce local evidence, and there has been a local response to Tracy's local findings. I think the response is in the context of all of those systematic reviews. So the logic model talks about the use of local findings. It doesn't say that we have to have a local finding that leads immediately to a change in practice. But what we do have is really an incentive to do something about a whole body of literature. So it's so easy for, not easy, but the Canadian Malnutrition Task Force did a wonderful job of collecting data in a very systematic way to document that we have a national problem. If that context was limited to Toronto, it would have been very easy for our leaders here on Vancouver Island to say, well, you know, Toronto's pretty different from Vancouver Island. And so I think what Tracy was able to do was say, we've got a national problem. We've got systematic review after systematic review saying malnutrition is a huge problem. And in addition to that, she was able to get the attention of local leaders on malnutrition, saying, we've got a problem here in our context, and we need to do something about it.
Thank you. That's very interesting.
Joanne, do you want to add to that?
I think you captured it really nicely. I think, you know, the local piece adds some additional context, which brings some meaning to sometimes where people can gloss over those national studies or systematic reviews or findings from elsewhere to say, you know, great, and we know that's an issue, but then to further substantiate it with a contextual relevancy in our area is even more powerful. So it just helps to build that case more fulsomely. But absolutely, I mean, it isn't to preclude that we want to do that. So, you know, in my work, for example, we look at, you know, legislative requirements, we look at accreditation standards, we look at the literature, we talk to other jurisdictions, we talk to subject matter experts, and so we do that fulsome review, and we also try to understand and then make meaning of it for what does it mean to this particular site or unit or setting.
So, Joanne, it's Kelly here. I have a question just in regards to your part of the presentation and that partnership with the UVic students around, you know, their knowledge synthesis exercises or evaluating qualitative and quantitative research. in a previous job, a part of my role as learning and effectiveness leader was to encourage and mostly nursing staff to do just that, to kind of take a look at the latest studies being published and give them a sort of a critical eye. And I know CRNBC, as part of their professional development plans, encourage nurses as well to kind of do self-directed research from journals and electronic resources. So is there any mechanism in place in Island Health to kind of do that with professionals in practice?
Thanks for that. Yes. I would say we do, and they're sort of more locally grown with particular groups and particular settings. So, for example, across the island, my team in professional practice support a community of practice for nurse practitioners. And so with nurse practitioner practice being fairly new, still on the island, just 10 years, that we felt that was really important to bring that group together. And they have really taken ownership of it now and meet monthly. And, you know, part of their day is, half of their day is sort of business kind of related stuff, but also the other half is around education and learning and support. And so that might involve, you know, presentations from one another or from outside guests. It involves journal reviews and things like that, lots of sharing. We've created, you know, workspace for them to be able to do that sharing. And I would say that that happens in pockets of other groups as well. So our public health nurses, for example, have a journal club, or our forensic nurse examiners have a community of practice and a journal club and review articles. They do peer review on case studies, things like that. So there are those things, some more informal than others, but they do exist. Mm-hmm.
Yeah, that's great. And hopefully now with more and more incentive for open access journals, that it's actually easier to even access those
exactly
studies.
And do that sharing. Yeah.
Yeah. So does anybody else have any questions they want to ask over the phone line? There don't seem to be any additional questions in the chat box.
Hi there. Can you hear me?
Yes, go ahead.
Yeah, okay, great. My name's Kara Pearson. I work up at the University of Victoria at the Institute on, what are we called, Aging and Lifelong Health. It's a new name. I had to step away from the presentation for a minute, so I apologize if you've already answered this, but if we have research findings that are useful for healthcare settings, is there a mechanism that we can use to kind of, like, is there some support for disseminating our findings, or?
Yes.
Yes?
Absolutely. It's Wendy, and I'm the one-stop shopping. And
you are? Okay.
Yes, so please do get in touch. We're very much interested in that. Our strategic research priorities align with the Institute. We're focused on older adults, mental health and substance use, Aboriginal health, and then anything related to health services delivery.
Okay.
So
yeah, go ahead. Go ahead.
We have quite well-developed collaborative initiatives with the Institute.
Great. So I work for, actually I have two jobs here. I work for the main office, but I also work for iPanel, which is, it's a provincial research practice collaborative that looks at palliative and end-of-life care. So I'm most familiar with the palliative and end-of-life care findings that we have here. So I don't know, like, do you work in specific areas or just all areas of healthcare?
Well, our focus is on the strategic priorities. So within older adults, certainly palliative care and end-of-life is a focus. So Kelly Stadjahar has certainly been very well connected with Island Health. I was a member of the School of Nursing Research and Scholarship Committee, and so you know, we have very good connections.
Oh, okay. Yeah, I work for Kelly, so if there's anything that I can help with in terms of research findings beyond what Kelly is doing and other team members, I'm very happy to help with that.
That would be great. So please do get in touch.
Sure, yeah.
So we have just a really rich infrastructure to support the research capacity building initiative. And great. So we have very good connections with faculty members, and we're really very fortunate because Cheryl Armstrong is the health project officer at UVic, and so we have opportunities for students. As I mentioned, our healthcare providers have great data. So Dr. Malone, for example, has data from a telehealth geriatric assessment unit. And through Cheryl Armstrong, we connected Dr. Malone and her data and her ideas with a faculty member in the School of Nursing and the School of Health Information Science. So there's a graduate student, just as an example, a graduate student who's now developing a thesis proposal around Dr. Malone's telehealth geriatric assessment unit.
Oh, great.
Yeah, so there are those opportunities, and then, so those are academic opportunities where the student's actually getting academic credit. And then in addition to that, we have research volunteers, and so again, Island Health is very open to connections with any academic.
Perfect, thank you.
It's Joanne. I would just add that Wendy could also be a great connector for you, so could link you in with our operational leader. So for the end-of-life program, Lois Cosgrave is the director for that area. So, I mean, just in terms of making some linkages, too.
Perfect.
Yeah. And I'll put in a good word for us. On July the 20th, there's a researcher from McMaster who invited Island Health to participate in an end-of-life research study, and that's Henry Sue. And so he'll be coming and giving an afternoon presentation as well as an evening presentation around his research on end-of-life.
That was July 14th, did you say?
July 20th.
Oh, 20th.
Yeah, so that is collaborative with the Ministry of Health, and we'll be sending out notifications. So Karen, you're welcome to go on our website and then join the listserv, and all events will be posted through the listserv.
Oh, okay, wonderful. Thank you.
Yeah.
Okay, thanks, Kara. We do have time for one more question if anybody has another question. All right.
Vincenza's on, or was expected to be online. She's always posing absolutely wonderful questions.
All right, well, so maybe we'll end it there. So thank you for everyone, to everyone for joining us on your lunch hour today, and thanks to Christine, our communications co-lead, for doing the technical hosting of the WebEx session today, and a big thanks to our two presenters, Wendy Young and Joanne McLaren. Thanks for sharing all of your work at Island Health, and for being such great knowledge translators.
Well, thank you for the invitation. It was really nice to have this opportunity to share information.
Yeah, absolutely. Anytime you have new information to share, please get in touch with us. And we invite everybody who's on the line who's not a member of our BC-KT Community of Practice to check out our website, bcktcop.ca, and sign up to be a member, and all the perks that come with that membership. So thanks again to everybody.
Wonderful. Thank you very much.